A Guide to Squatting: Anatomy, Technique, Training Progressions and Modifications by Muscle Recovery Solution. Bones involved in the squat. The pelvis, comprised of the ilium, ischium, pubis and sacrum. These bones form the acetabulum, hip joint, and the sacroiliac joint. The pelvis plays a key role in stabilizing the body during squats. The sacroiliac joint connects the sacrum to the ilium, the femur, the upper leg bone that connects the pelvis at the hip joint and the tibia at the knee joint. The head of the femur articulates with the acetabulum, facilitating movement of the hip. The patella. The kneecap protects the knee joint and increases the efficiency of the quadriceps during the knee extension by acting as a pulley, helping to extend the knee more efficiently. Tibia and fibula. The tibia is the main weight-bearing bone of the lower leg, while the fibula provides secondary structural support and does not bear much weight directly. Talus, calcaneus and the foot bones. The calcaneus, the heel bone, and the talus, part of the ankle joint, play a key role in load bearing, while the arch of the foot provides a stable base and shock absorption. Anterior muscles involved in the squat. Quadriceps. The rectus femoris, vastus medialis, vastus intermedius, vastus lateralis extend the knee, which straightens the leg during squats. The rectus femoris also flexes the hip. Tensor fascia latae controls hip abduction. It also plays a role in hip flexion. Sartorius. This muscle flexes both the hip and the knee. So is major and iliacus. These key hip flexors lift the thighs, but their role is secondary to the glutes and hamstrings in squats. Tibialis anterior, responsible for dorsiflexion of the ankle. It stabilizes the foot and controls the movement during the eccentric phase. Extensor hallucis longus and extensor digitorum longus. These muscles extend the toes, contributing to balance, but are less crucial than the larger muscle groups. Posterior muscles involved in the squat. The gluteus maximus, gluteus medius. The glutes are essential for hip extension, standing up from a squat. The gluteus medius helps stabilize the pelvis and prevents the knee from caving inward. Hamstrings. The bicep femoris, semitendinosus, semimembranosus help the knee with flexion and hip extension. Gastrocnemius and soleus. These calf muscles stabilize the ankle and assist with plantar flexion during the concentric phase. Deep hip rotators. These muscles help stabilize the hip and assist with rotation, but their role in the squat is secondary to the glutes and hamstrings. The deep hip rotators are the piriformis, obturator externius, obturator internius, gemellus superior, gemellus inferior, and quadratus femoris. Tibialis posterior contributes to plantar flexion of the foot, helping to stabilize the ankle. Popliteus and plantaris, important for knee flexion and stabilization, with the popliteus helping unlock the knee and initiate flexion during squats. Squat phases and joint actions. A squat involves two main phases: the eccentric phase, which is the lowering, and the concentric phase, raising. The first eccentric phase, the hip joint action, is flexion. The knee joint action is flexion. Ankle joint action is dorsiflexion. The second phase is the concentric phase. The hip joint action is extension, the knee joint action is extension, and the ankle joint action is plantar flexion. The role of muscles in the squat. The prime movers are the main muscles driving the movement, which are the quadriceps and gluteus maximus. The synergists assist the prime movers, which are the hamstrings and the adductors. The antagonists oppose the prime movers, which are the hip flexors. The fixators, they stabilize and prevent deviation. These are the core muscles, the gluteus medius and erector spinae. Dynamic warm-up stretches for squats. Before performing squats, it is essential to activate and mobilize key muscle groups. The leg swings, front to back and side to side. This improves hip mobility. Butt kicks. This warms up the hamstrings. High knees activates the quadriceps and hip flexors. Ankle roll. This prepares the ankle for squat depth. How to perform a squat. A step-by-step guide. The first is the foot placement and stability. Feet should be shoulder width apart, toes slightly outward, weight evenly distributed. The second, engage the core and brace. Push the belly button inward and brace to stabilize the spine. Third, push the hips back. Push the hips back first, then lower with controlled knee tracking. The fourth, the knees should track over the toes without collapsing inward. The fifth, maintain a neutral spine and the knees should be level with the hips. Squatting with different arm positions. Hands by the side may cause an increased forward lean and requires more core engagement. Hands in front helps with balance and upright posture. Hands overhead reduces forward lean but challenges shoulder mobility and balance. Common squat mistakes and corrections. First would be knee valgus, which is knee caving in. This is due to weak gluteus medius, or it could be due to poor control. To fix this, do glute abduction exercises by side-lying leg lifts. Second would be excessive forward lean and rounded back. This may be due to tight hip flexors. A fix for this would be a hip flexor stretch, either a deep lunge or using a Swiss ball to arch over. The third would be heels lifting up. This may be due to tight calf muscles or an issue with the ankle joint itself. A fix for this, if it's tight calves, would be to do a calf stretch. Squat progressions and variations. The first would be the bodyweight squat. This is great for beginners to learn proper squat mechanics. This strengthens the legs, the glutes, the core without added stress. When to progress? Move to the goblet squats after mastering form with 3 sets of 12 to 15 bodyweight squats, ensuring full range of motion and stability. Second is the goblet squat. This requires holding a dumbbell or kettlebell at chest level. This enhances core engagement and posture while improving squat depth. When to progress? Move to the barbell squats after achieving 3 to 5 sets of 8 to 10 reps with a challenging weight. Third is the barbell squat. This builds full body strength and allows for heavier resistance while maintaining form. When to progress? You can start incorporating sumo squats at this point, as they require a different movement pattern that emphasizes the inner thighs and hips. Fourth is the sumo squat. This is wide stance with toes slightly pointed out. This targets the inner thighs, the adductors and glutes more than the standard squat. When to progress? Move to Bulgarian split squats once you've built enough strength in your legs and hips to focus on unilateral leg work. Fifth, we have the Bulgarian split squats. One foot is elevated behind on a bench or platform. Great for single leg strength, balance and mobility. When to progress? Move to jump squats once you've built enough sufficient unilateral strength and are ready to add power and explosiveness. The jump squats adds explosive element by jumping at the top of the movement, and this improves power, agility and cardiovascular endurance. Progress onto the pistol squats once you've developed enough power and stability and can single leg control. Last is the pistol squat. This is a single leg squat. Requires balance and control. This improves unilateral leg strength and mobility. General benefits of squatting. It strengthens the lower body, enhances core stability, improves mobility and flexibility, boosts athletic performance, increases bone density, aids in fat loss, improves balance and coordination, and enhances posture. Contraindications of squatting and risks. Severe knee injuries, lower back issues, hip impingement and arthritis, ankle mobility restrictions, osteoporosis, balance disorders, recent surgeries. Please note, consult a professional for modifications. Here are some squat modifications options for limited mobility. The first is the chair heel press, which is the static exercises. Sit in a sturdy chair with feet flat on the floor and knees bent about 90 degrees. Press through your heels, engaging the muscles in your legs, glutes, hamstrings and calves without lifting your feet. Hold the position for 5 to 10 seconds, then relax. Repeat for several sets. The benefits of this activates and strengthens the muscles in the legs and glutes without movement or strain in the joints. This is great for improving muscle activation and endurance. The second, the chair squat. Sit to stand. Sit in a sturdy chair with feet flat on the floor and knees 90 degrees. Slowly press through your heels to stand up, using your arms for support if needed. Lower yourself back down. Slowly sit again, maintaining control and good posture. The benefits of this introduces the basic motion of the squat while using the chair for support. This builds leg and glute strength while improving balance and control. The third is the mini squats with a stability ball. Place a stability ball between your lower back and wall. Squat down to a partial depth, about 1/4 or half, using the ball to support your back. Then return to a standing while maintaining control and form. The benefits of this, the ball helps with posture and stability, allowing you to squat with less risk of poor form. This targets the glutes and quads while reducing strain on the knees and back. Fourth is the partial squats. Stand with feet shoulder width apart and engage your core. Lower your body into a squat position, but only go about 1/4 of the way down. Ensure your knees stay behind the toes and chest stays upright. Return to standing. The benefits of this focuses on building strength in the muscles involved in squatting without going too deep. This reduces stress on the knees, making it a safer option for beginners or those with mobility limitations.